One of the unusual aspects of I think Canadian medicine is that there's this Royal College of Physicians and Surgeons that got set up in 1929 to recognize all the specialty areas that were coming along, and yet this family medicine is a separate college, and I'm often asked, was often asked, why, and I just wondered if you could talk about what, well, do you feel that we do need our own college as a discipline of family medicine, and what makes that a good thing, I suppose?
Yes, I do. I think it was a wise decision by those involved in making the decision at the time, and all of us who've read the history know about the tensions that existed and you know, the debates involving the Royal College, who'd been formed 25 years before we became officially a college in 1954. The Royal College was established in 1929. The CMA, who had the authority to basically make the decision to approve the formation of these colleges. And without going into all the pros and cons, it was a fairly heated debate. But I think it was a wise decision, because I think family medicine is quite different from the other specialties. I think the other specialties have more in common with one another. Half the doctors in Canada belong to the other specialties, and half of them are general practitioners and family doctors. And the family physicians represent, in a very healthy way in our system, and I think systems that are like Canada's system, this is one of the great strengths, they are the front line of the entry into the medical care part of the system. And I think that if a system supports that properly, that's a very important thing. But it's quite different than the other specialties. We should not be at the same level where people could come in at any one of those levels and we're seeing ourselves as all the same. The importance of being different, as Ian McWhinney wrote about, applies not only to the difference in the clinical practice, it applies to the differences in teaching and in the context of that teaching, and the differences in research that has to be carried out and where the support should go. And if it all gets mixed together with those who see themselves as part of the same organization, there's an excellent chance that that could be lost, that importance of being different. Patients benefit by having family physicians who help them and advocate for them for that very difficult journey through the healthcare system. And the fact that we are recognized as the specialty that you go to for all of your care, and that can and should then be working with you as the patient to help to direct you to all of the other specialties when needed, is critical. If we are all the same and we became part of the same club, if you will, I have a great concern that we would not be seeing ourselves as that unique and different discipline that we really are. I do believe that the relationship between the College of Family Physicians and the Royal College of Physicians and Surgeons is critically important, and that a very positive and strong relationship should exist with very honest sharing of our tensions and concerns. I've always believed there's compromise that can be found in any of these kinds of tensions, and that we should respect one another as different in many areas, and yet having the same objective of trying to serve the public at the center. I think that in terms of the voice representing family doctors and the patients they serve, which is not just a select subgroup who see us because they have a problem with a particular part of their bodies, that one organ isn't working. This is the total person. We need our own voice. We need our voice that is represented to other organizations within the system. We need our voice to the public, very importantly. We need our voice to government that is different than the voice of the Royal College. Many times we should be there together, voicing concerns for all. But we need to voice that concern as an independent body that represents the whole patient. And I think that the way to do it is with an organization that is functioning and organized, and its infrastructure is separate, yet builds strong bonds with Royal College, with Canadian Medical Association, with the other major healthcare and medical associations.